Hi, I'm Liz Gately. I'm a physician assistant with TriHealth Cancer and Blood Institute, and I'm here to talk to you about female sexual health after cancer today. Sexual health has been increasingly recognized as an integral aspect of quality of life during and after cancer treatment. Modalities used to treat cancer, including surgery, radiation, chemotherapy, and hormonal therapies, have all impact on body functions and image related to sexual function. Women with cancer diagnoses consider their sexual health to be one of the three most important aspects of quality health care. And while 74% in one study believed their doctor should discuss this, such discussions did not occur 62% of the time. In one study, 43 physicians and nurses regularly treating women with ovarian cancer were interviewed. 98% reported they felt sexual issues should be discussed with patients. Only 21% reported doing so. Why is this important to you? This is important for two reasons. Reason number one, your doctor feels that this is an important conversation to discuss, and you should feel heard when you're having issues related to sexual function. So this should validate your desire to have that conversation with them and empower you to start that discussion if they haven't initiated that with you first. Reason number two is other women like yourself are just as concerned about this aspect of their health as you are, and you should recognize that you are not alone in wanting to have these conversations. Female sexual dysfunction can include a number of different concerns. The two main issues that are most commonly addressed following treatment for cancer are sexual desire disorder or decreased libido and sexual pain disorders. The way that we think about our self-image and sexual self-schema, or our view of our sexuality, is significantly altered following treatment for cancer. In patients who have an experience of distress in their relationship, depression, or side effects related to treatment, those patients can experience more challenges with their sexual health following treatment. Sexual desire disorders following surgical intervention, radiation, and chemotherapy can occur as a result of the change in body image. Changes that happen to our bodies related to surgery, chemotherapy, such as hair loss, radiation therapy, and changes to our body related to that can all cause a different view of how we see ourselves in the sexual setting. One study showed women receiving ongoing anti-estrogen therapy, a common treatment in breast cancer, but also in other cancers, showed that patients can have challenges with sexual dysfunction. In studies for those patients, the experience of treatment with that medication actually was the greater detriment to their sexual health than the actual loss of hormones related to that itself. So what this means is our mind's perception of how we feel when we're on those medications is a crucial factor in how we experience our sexuality. If you're experiencing challenges in this area, one area that could be helpful to you is talking to your provider about sexual health counseling or therapy. This is an option that should be or could be offered to all cancer survivors with sexual complaints, specifically to address the anxiety, stress, or comfort in the intimate setting that you may experience as a result of the treatments you've received. Couple-based interventions, including your partner, could also be of benefit to you, not just engaging in these encounters with a therapist yourself, but also with your partner. One way that you can contact someone and find a counselor who may be helpful to you is through the American Association of Sexuality Educators, Counselors, and Therapists. You can refer to the website www.aasect.org to find a counselor that could be helpful for you and or your partner to help you with a sexual disorder or decrease in your libido. The second and most common area of sexual dysfunction that I'd like to discuss is pain disorder. This disorder is very common, related to thinning and atrophy of the vulvovaginal tissues. One way that patients can benefit from additional treatment to this area is by simply using a vibrator or self-stimulation in their home setting. This can be beneficial to them by promoting oxygenated blood flow to the pelvic floor. This increased oxygenated blood to those tissues can help to heal any small little tears in the vagina or vulvar area and allow for better stimulation and increased healing in that region. Additionally, other treatment options can include use of vaginal moisturizers or lubrication. Pain may be caused by vaginal dryness secondary to lack of vaginal estrogen following surgical removal of the ovaries, or related simply to changes in the tissue from radiation. Estrogen loss can cause reduced elasticity or stretching of the vaginal tissues and moisture content in that area. This often results in chronic vaginal dryness and discomfort. These issues can lead to avoidance of intimacy and fear of engaging in sexual activity, but also day-to-day vaginal dryness. The key to preventing or at least improving these problems is to restore moisture to these areas. Vaginal moisturizers are non-hormonal over-the-counter products intended to be used several times a week routinely for vaginal health and comfort. This is what I like to think of as the lotion for the vagina, something you would use on a regular basis to help restore hydration to those delicate tissues. Some key examples of this can include products you can receive simply from your grocery store or local pharmacy, like Replens or Luvina, which come in both a cream or suppository type product. Additionally, there are products made from hyaluronic acid, including Hyalogen or Reverie by a company called Bonafide, that can be found online and can be purchased in that arena. Any of these products can be used as frequently as daily or as little as you need to in order to maintain the general moisture content of the vaginal tissues to improve that day-to-day dryness and the overall quality of the tissue. Vaginal lubricants, on the other hand, are liquid or gel products meant to be applied to the vulva or into the vagina to minimize dryness and pain during sexual activity or penetration. It's important to avoid lubricants that have any perfumes, flavors, or heating qualities that could irritate the delicate tissues of the genital area after you've undergone treatment for cancer, including radiation, chemotherapy, anti-hormonal therapy, or surgical intervention. When used properly, vaginal lubricants can prevent irritation and tears to the vaginal tissue caused during the friction of intercourse. This can reduce your chances for developing vaginal infections and having additional pain following intercourse. They are available in multiple formulations, including water-based and silicone-based products. Water-based products can be helpful for day-to-day use, particularly if you are utilizing a vibrator additionally to help increase healing content to those tissues. Silicone-based products are not compatible with vibrators or vaginal dilators, which we will get to. If you are engaging in intercourse regularly with a partner, however, I would recommend using a silicone-based product. If dryness is your baseline issue, silicone-based products will absorb less into those vaginal tissues, and you will have more success with keeping that reduced friction content that you are looking for. An additional way to help treat vaginal pain disorders is by using vaginal dilator therapy. This is something that your healthcare provider may be able to introduce to you, or they may need to refer you to a specialist or pelvic floor physical therapist to discuss proper use of a vaginal dilator. These can be beneficial for some postmenopausal women after treatment of cancer to help regain elasticity of the vagina and to help you develop the confidence to have something inserted into the vagina without pain. These are commonly prescribed for patients after treatment for radiation to help maintain patency and elasticity of the tissue, but can also be utilized prior to intercourse as a means of pre-stretching those tissues and preparing you for vaginal penetration. Dilators can be taught to patients using pelvic floor physical therapy. Teaching pelvic muscle awareness and control is an important component of successful treatment of vaginal pain. Vaginal pain can often be caused by tightness or extra tone in the pelvic floor muscles that control the elasticity or stretchiness of vaginal structures. In order to reduce pain with intercourse, some women need assistance in learning to control those muscles surrounding the vagina, and this education can be gained through pelvic floor physical therapy methods and what we call biofeedback. A referral should be made to a specially trained physical therapist to evaluate these issues and treat any problems that may exist in the pelvic floor muscles to help reduce pain with intercourse, pain with dilator use, or overall discomfort in the pelvic floor related to high tone or other diagnoses that affect the structures of the pelvic floor. Physical therapists can be identified as specialists in pelvic floor through the American Physical Therapy Association. You can search for a pelvic floor physical therapist at the website www.apta.org or ask your healthcare provider at TriHealth for an internal referral to our physical therapy pelvic floor department. There is a role, additionally, for topical or systemic estrogen therapy in the treatment of vaginal atrophy or pain related to thinning of the vaginal tissues as a result of loss of estrogen. This is a tricky topic to discuss in cancer patients because some cancers are hormone sensitive, such as breast cancer, uterine cancer, or ovarian cancer. In these patients, your physician or provider may recommend that you avoid any exposure to estrogen-based products. In non-hormonally driven cancers, such as rectal cancer or colon cancer, where the pelvic floor or pelvic tissues are still affected, vaginal estrogen may be an excellent way to treat this patient population to help improve the quality of those tissues. Not all vaginal estrogens are created equally. Some patients, even with a hormonally driven cancer, can receive treatment with the approval of your provider using low-dose vaginal estrogen therapy. But this should be recommended and approved by your oncologist or specialist prior to initiation of therapy. Additionally, there's an option that may be beneficial to you called DHEA. Vaginal DHEA is an estrogen prohormone, the medication that comes prior to estrogen in our systems. This medication can be formulated either through a compounding pharmacy or as a newer product called Intra Rosa, which is a vaginal suppository that can be used to help improve the vaginal tissue's ability to convert estrogen into those cells locally, but not into the rest of the body. This is something that you should discuss with either your gynecologist or a specialist who has expertise in prescribing this medication. One final option to discuss with your provider would be a referral to a specialist who has the ability to provide a service called Mona Lisa Touch. This is an office-based laser procedure that delivers laser energy to the vaginal wall tissue and works in a way that triggers production of new cells that improve and restore the quality of the vaginal mucosa. Generally, this occurs over 3 treatments and takes just a few minutes to administer each time. This is FDA approved, however, it's not often covered by insurance and is something that you should discuss with your provider as a last option resort. Treatment options for patients vary depending on the type and cause of sexual dysfunction that the patient is experiencing. As addressed today, you may be improved by using something as simple as lubrication or moisturizers. Your provider may recommend use of a vaginal dilator or referral to a sexual health specialist. They may recommend that you meet with a sex therapist to discuss cognitive behavioral therapy. There are a number of options that exist, and the most important thing for you is to know there are treatment options and that you should feel comfortable talking to your provider about the opportunity to have a referral to someone who is willing to discuss these options with you.